All right, today we're going to dive into a medical detective story. It's a fascinating case where just one single type of cell in our body, a cell that's supposed to be one of the good guys, goes completely rogue. And when it does, it sets off this whole cascade of problems that at first seem totally unrelated. So picture this. Our story kicks off with a puzzle that doctors see all the time. A patient, usually in their 60s or older, comes in. They're just wiped out, exhausted all the time. Their back is killing them, and they can't seem to kick this string of infections they keep getting. You look at these things and you think, okay, maybe these are just three separate issues of getting older.
But what if they're not separate? I mean, what if there's one single culprit that could connect bone pain, that kind of deep, crippling fatigue, and a tanking immune system? Well, that is the central mystery of the disease we are talking about today, multiple myeloma. To solve this puzzle, we've got to start our investigation by identifying the bad guy. And in this case, our prime suspect is a very specific type of white blood cell that is basically turned on the body it was designed to protect. We're talking about the plasma cell.
So let's be clear, in a healthy person, plasma cells are absolutely the good guys. They're like the elite antibody factories of our immune system, hanging out in the bone marrow. Their entire purpose in life is to pump out this huge, diverse arsenal of antibodies, where each one is perfectly designed to hunt down and take out a specific invader, like a virus or some bacteria.
And here's where you see the stark difference. On one hand, you have a healthy immune system, with all these different plasma cells making a whole variety of useful antibodies. But in multiple myeloma, one of those cells becomes cancerous. It starts making endless copies of itself, a single malignant clone that just takes over. It floods the body with enormous amounts of one single totally useless antibody, which we call a monoclonal protein, or M protein. It's like a car factory that's supposed to make sedans, trucks, and SUVs, but instead, it just starts churning out millions and millions of faulty left-side mirrors.
Now, this out-of-control army of rogue cells, they don't just stay put in the bone marrow. Oh no, they leave a trail of destruction all through the body. And clinicians have a really powerful way to track all that damage.
And that trail of evidence is wrapped up perfectly in a simple but incredibly helpful acronym, CRAB. Each letter stands for one of the main ways multiple myeloma damages the body, and it gives doctors a really clear roadmap for what to look for.
So first up, C is for hypercalcemia. That's just a fancy way of saying high calcium levels in the blood. Here's how it goes down. The cancerous plasma cells release these signals that tell the body's bone-destroying cells, called osteoclasts, to go into absolute overdrive. Bone gets broken down way faster than it can be rebuilt, and all the calcium stored in that bone gets dumped into the bloodstream. This calcium spike is what causes all kinds of trouble, from confusion and constipation to intense thirst.
Next in our acronym is R, for renal failure. Remember that useless M protein we talked about? Well, the smaller bits and pieces of it, these things called light chains or Bence Jones proteins, are directly toxic to the kidneys. They build up and essentially clog up the kidney's super delicate filtering system, and that can lead to really serious kidney damage.
Then we have A for anemia. So these cancerous plasma cells are growing and multiplying inside the bone marrow. That's the exact same place where our red blood cells are supposed to be made. The cancer literally crowds out the healthy red blood cell factory. So with fewer red blood cells to carry oxygen around the body, the patient feels that really profound fatigue we mentioned right at the start.
And last but not least, B is for bone lesions. Now the cancer delivers a real 1-2 punch to the skeleton. It supercharges the cells that break down bone, and at the very same time, it slams the brakes on the cells that are supposed to build new bone. This massive imbalance creates weak spots. Doctors call them lytic, or punched-out lesions. And these are what cause that terrible bone pain and can even lead to fractures from something as simple as a cough.
Okay, so we have our symptoms, the whole crab constellation. Now, how does a doctor take these clues and gather the hard evidence they need to actually confirm the diagnosis?
Well, it's pretty systematic. Each clue points right to a specific test. That fatigue, it leads to a complete blood count to check for anemia. The bone pain, that calls for a skeletal survey or other imaging to hunt for those punched-out lesions. And to find the real smoking gun, that monoclonal protein, doctors order a special blood test called a serum protein electrophoresis, or SPEP, which will show a really characteristic M spike. And get this, here's another amazing piece of the puzzle. All of that extra M protein floating around makes the blood kind of sticky. So when a lab tech looks at a blood sample under a microscope, they might see the red blood cells literally stacked up like little rolls of coins. It's a really distinct and kind of ominous sign called rouleau formation. So the culprit has been identified. The evidence is overwhelming and the diagnosis is confirmed. The next step, the most critical step, is to start fighting back.
The strategy for treatment is incredibly pragmatic. While everyone is planning the long-term cancer therapy, the number one immediate priority is to manage the life-threatening complications that the disease has already caused. It's a complication-first approach, basically triage.
And this brings everything full circle, connecting our problems directly to their solutions. For that high calcium, IV fluids are pumped in to hydrate the patient and flush it out. For the kidney failure, aggressive hydration is also key. For the anemia, medications can be given to help boost red blood cell production. And for those bone lesions, drugs called bisphosphonates are used to slow down the bone destruction and lower the risk of fractures. It's a direct, targeted response to every piece of damage caused by the disease.
The whole CRAB framework is such a powerful tool for finding and fixing the damage that rogue plasma cell leaves behind. But it also begs a really profound question for the future, right? How do we go from just cleaning up the mess to stopping that very first cell from ever going rogue in the first place? That, right there, is the next frontier that researchers are pushing into right now.